careful.
Feel a thing.
Cool. Turn your head to the left. Great. Let me know if any point you feel something. You know, we were talking about whether it's better to have patients lying head down versus sitting up, and I always do my donor strips with the patient sitting up like this. I just think it's less claustrophobic, it's more comfortable for them.
Yeah.
And
Let it run the right direction.
exactly.
Less pressure up there.
Exactly. You're not going to bleed as much because there's less pressure down there. So, and obviously you seem pretty comfortable doing this. Table down just a bit of candy. Take his arm, Linda. Make sure he's nice and cozy. What are your favorite procedures to perform?
Tuck, breast lift, breast auto.
You do a lot of lipo as well?
Yeah.
Grab this, please. Thank you.
It's okay. Is my nephew here today?
No.
Okay, no, he's not here. Is that here?
I'm a number of the plastic surgeons. Actually, I lectured a couple of years ago at the Florida Society, put pressure right there, at the Florida Society of Plastic Surgery, which was nice. I forgot the exact name for your organization. It was nice. I met, actually it was, the other lecturer was, who was it now that lectured? Someone else. Michael Petit, I think, lectured. Do you know Michael? Oculoplastic surgeon. And I spoke on hair. And, oh, I know who else. Also, Menick. Burgett or Menick, one of those two, you know, the nasal reconstruction guys. It was pretty cool. It was a nice group of guys.
You ever seen a guy named Dean Tomorian's work?
Who?
Dean Tomorian.
Toriumi.
Torino.
Sure.
Amazing.
Yeah, Dean is a very impressive rhinoplasty surgeon.
Beyond amazing.
I've known Dean for years. He's probably the top guy in the Facial Plastics Academy. You know, he wrote that definitive book. Open structure rhinoplasty is what
It's just amazing.
Yeah. Very aggressive. I mean, he reconstructs. You know, he basically, you know, there's no shortcuts. He doesn't do anything but total, you know, redoing of the entire nose. You know, from rebuilding the whole structure and everything. Suture, please. Yeah, I've actually sent a few patients to him, just because, you know, he does things that no one else can potentially do.
I only do what I can do, you know? If I can't get a good result, I
Figure out what you do best. I agree. Thank you. Thank you. Where are you putting your sutures in? Doing all right?
Me?
Yeah.
Yeah.
Okay. What?
It's just funny.
Everything?
You usually
You
do
didn't even
this.
take any drugs. It's funny.
Silly me. Feel that epi though.
Read a little bit. Your nose strips coming together beautifully. What I like to do is I take my donor strip out in two separate sections, so everything stays nice and fresh. We're starting to do the dissection now. Is Vivian here yet, Linda?
Yes,
Yes.
called her, yeah.
Okay.
Oh, you mean you'll do it later?
I take out a portion of it, and then I take out like 2/3 to 3/4 of it, and then I take out the rest.
That's a good idea.
So it stays nice and fresh. Even though I've got 8 to 10 grows working on it, and another 2 planting, it still leaves everything as fresh as possible. Hi, Vivi.
Hi, doctor. How are you?
Good. How are you?
Sorry, Aggie.
Good. 15. You fighting?
No, I'm good.
He's smiling for camera.
Just making sure. You got a nice loose scalp. It's nice. Get a nice large strip, which is nice.
Bigger the better. Take it all.
I like that spirit.
Ali,
I like that spirit in the patient.
Alicia.
We haven't had that spirit here since.
I was just thinking that.
1969.
1969.
What was that movie? And what was that song?
Hotel
Oh
California.
yeah. We haven't had that spirit here since.
Mercy's always singing that song. She had no idea what that meant, so it's scary here.
Nice and dry. A couple more stitches. We'll let you sit back. Get you ready to go. Yeah, please. Beautiful, bye.